Minnesota is blessed by water. In the state of 10,000 lakes and multiple streams and rivers, water is all around us and runs through us. Water stimulated the lumber, flower, agriculture, and tourist industries that help shape the culture, economy, and people of our state. Water has made us who we are. However, Minnesota's abundance of clean water has lulled much of the public into taking our water legacy for granted. In reality, we have some major water issues that are threatening our future. Most of the lakes and streams in southwest Minnesota have been deemed unsuitable for swimming or fishing because of pollution. Many of our public water supplies are threatened by increasing levels of nitrates, the cause of blue baby syndrome. And our public water systems in Minnesota and across the country are in need of major upgrades to prevent a tragedy similar to that playing out in Flint, Michigan. When you add that to the fact that our water needs will soon exceed our water supply, you can see that water quantity and quality are things that are urgent for us to address. Water is a public health issue that demands our attention. We will give it that attention on today's episode of A Public Health Journal. Please stay tuned.
Welcome to A Public Health Journal, a program that explores the public health issues facing our society today and tomorrow. The host of our show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health, the Hennepin County Human Services and Public Health Department, and the Minnesota Public Health Association, all working together towards the goal of healthy people living and thriving in healthy communities.
Welcome to A Public Health Journal. Access to safe and clean water is essential to public health. In fact, the field of public health evolved around the issue of water. So today we'll be talking about water and public health. In particular, we'll be talking about the state of water in Minnesota, what risks threaten our water supply, and what needs to be done to address those risks. Joining us in that conversation are Tannie Eshenaur, Planning Director for Drinking Water Protection at the Minnesota Department of Health, and Anna Henderson, Water Advisor to Governor Mark Dayton and Lieutenant Governor Tina Smith. Tannie, Anna, welcome to the show.
Thank you.
I'm going to start with you, Tannie, to tell a little bit about what role does the state health department play in water, and what's your role in that mix?
Sure. So at the Minnesota Department of Health, with our mission to protect the health of Minnesotans, we focus on the area of water, obviously drinking water, both public water supplies and then private wells that are owned by homeowners. Then we also look at water in the area of beaches and whether they're safe to swim in along the north shore of Lake Superior, and then fish and the contaminants that are found in fish, and how can we encourage people to eat more fish but choose wisely which fish they eat. My role specifically is around planning, strategic planning for drinking water in the state of Minnesota. So along with a team of scientists at the health department, we look at how we can ensure that there's safe water and sufficient water available everywhere in the state, now and in the future, through a series of strategic safeguards from our source waters, rivers, lakes, and streams, and groundwater, all the way to the taps in people's homes.
Right. And Anna, it's obvious, I think, to most people why the health department would be engaged in water, but why is the governor's office engaged in water, and what's your role in helping the governor and the lieutenant governor deal with water issues?
So water has become a very important issue to the governor and the lieutenant governor as reports have been coming out about concerns with our lakes and rivers and streams and also drinking water. And the governor has wanted to elevate the importance of these issues and to really accelerate the pace of progress in advancing where we are and making sure that we have lakes and rivers in all parts of the state that are swimmable, fishable, and that the water that comes into our treatment plants is treatable to get to a standard that is safe for public health. The governor always talks about this being the land of sky blue waters, and I think it's really shocking to him that we have so many problems with our water and that not everybody in the public understands or knows about these problems and concerns, and he really wants to elevate those. And so by creating a position in his office to have a water advisor, it allows him to work on this issue more. In my role, I work with the legislature, I work with the state agencies. There are many state agencies that work on water, and I work with the stakeholders. And one of the things that I've been doing is helping the governor to put on different public engagement processes to really bring the public and citizens of Minnesota into this conversation on water.
So why is water overall important to the state of Minnesota? from the governor's perspective, from that really statewide perspective? Why is it important?
It's one of our biggest treasures, and the wealth of the state that we start with is our abundant water resources that allow businesses that need water to come work here. They provide recreation, wildlife, and we need to make sure that this treasure that we have is sustained into the future. And really the concern is that we are doing things that could use up water in certain places or contaminate it in others, preventing future generations from having these great resources that we have.
And Tannie, from a public health perspective, why is it important to our health? Why is clean water so important to our health?
Well, it's part of creating the conditions in which communities can be healthy. We want to prevent waterborne disease, pathogens that are found in water. We want to prevent diseases that can come from exposure to contaminants in water, pollutants that are there. Water is also key in dental health. The fluoride that we put in water in Minnesota allows us to have less dental caries in the state, dental cavities. And then it's a foundation for a healthy economy, and sometimes we forget that when we take water for granted. The city of Blaine had 2 times in the recent months where they didn't have water and businesses had to close. And so water supports all of these conditions which enable communities to be healthy.
Now, I know we take water for granted and we take the safety of water for granted, but I know that's not always the case. And I know you lived overseas for a while and had a reflection with your kids about the safety of water. Tell me a little bit about that.
Sure. When we were just graduating from our graduate work at the University of Minnesota, we went to Ethiopia in East Africa to do a water supply project in villages there, right after the 84-85 famine. And we took our children with us, of course. Peter was 3, Katie was 5. We were there working in village water supply for 4 years, and then we came back to the United States to visit Grandma and Grandpa, landed at the airport, drove to my parents' house in suburban New Brighton, came into the house, and Peter, who was then a preschooler, said, I need some water to drink, so we took him to the tap in my parents' home, and Peter looked at me for a clue, and he said, Mom, is this water safe to drink? So my mother was a little bit offended. But it was a natural question for Peter, because for the last 4 years, whether or not the water was safe to drink was a question he needed to ask.
So we take it for granted, but that's not a given throughout the...
Not in the rest of the world.
And Anna, do we take water too much for granted in this state of 10,000 lakes, this land of 10, sky blue waters?
I think that we do. And we take for granted that there might be problems with things that we're doing and that actions that we take contribute to problems with water. And we just take for granted that whatever we do and however we use the water, it's still going to be there and it's going to be healthy and it's going to support wildlife and all the recreation we want.
All right. Well, I want to talk about some of the problems that we're facing with water, but first we need to take a little break. We'll be back right after this message. Welcome back. We're talking about water in Minnesota with Anna Henderson from the Governor's Office and from Tannie Eshenaur from the Minnesota Department of Health. Anna, from your perspective, what are some of the issues facing water in Minnesota? What are some of the problems that we're seeing?
Some of the problems, starting with drinking water and the public health aspect of it, is that we have nitrate in our groundwater, which many of us use as our drinking water source. And we're seeing increases in those, and as we are able to go out and measure and see what is there. We're finding more and more places that have nitrate levels that exceed what's considered safe for human health. And about 80% of our population is on municipal systems, which the Department of Health makes sure that what comes out of that system is safe. But another 20% of our population is on private wells, and those wells aren't tested by the state. And sometimes the water tastes just fine, but there's actually something in it like nitrates that is a concern for public health. We're also seeing problems with eutrophication in lakes and rivers where there's...
What does that mean?
So there's too many nutrients that help plants grow that are coming from chemicals that we use on our lawns, that we use in agriculture, and this is phosphorus, also nitrogen, and it allows algae and other things to grow, and you can get these really kind of ugly looking outbreaks of algae. Some of those algae outbreaks can be toxic. We've had deaths of dogs that swim in that water. It can make humans sick. So these are a really big concern. And these are problems that are spread out all over the state.
Are there parts of the state that are more prone to water problems? You know, I know in my opening I mentioned the fact that in southwest Minnesota, much of the water is not swimmable and not fishable. And that's where a lot of agriculture is. Is that a little bit more at risk than, you know, the lakes region of northern Minnesota?
So the two main factors that make an area at risk are, what is the natural geology? What kind of soils do you have? So in the southeast corner of the state where we have karst landscape, what you put on the surface of the land flows down through that karst into the groundwater. So it's really vulnerable to contamination. Same in the central sand plains. What you put on those sandy soils, it just goes right through the ground into the groundwater. The other piece that makes people vulnerable is if you're doing activities on the land that contribute to pollution. So if you're doing a lot of activities that involve chemicals that are subject to runoff. And so agriculture, lawn care, these are things that there are a lot of chemicals that are used and they can run off and get into the water systems.
Now we're learning a lot about chemicals, and the industry over the last 100 years has, really developed and used a lot of chemicals. Are we seeing some problems with chemicals that in the past we thought were safe, but now we're starting to find out that may have some harm from big industries in this state?
Yeah, so there are over 80,000 chemicals in the products that we use in our houses, in our industries, in medicines that we take, and we don't always realize that when we start using those products that they're going to end up in our water and that those might be a concern. And there are studies, and the Department of Health is doing leading work for the nation on looking at these chemicals in our water, but we go to very remote bodies of water and find chemicals that are from humans that could be a concern for health. And the really big challenge is that we don't have studies on all 80,000 chemicals that are being used for what is safe for human consumption.
All right. And Tannie, from your perspective, what are the health issues, the concerns that you have, the problems that you're seeing from the health department perspective?
I would say that if we look to our neighboring states and cities that have had issues around drinking water, we get a look into the future to what could be a problem in Minnesota. And using our public health model, we need to stand up and take action now to prevent those things. So, for example, what happened in Flint, Michigan with lead and infrastructure. We have a similar situation here in Minnesota in that lead service lines and plumbing and solder and fixtures all could put lead into our drinking water. In Minnesota, we have some steps in place that we think will help prevent lead, such as when a system changes its source water, like they did in Flint, they have to have prior approval from the Minnesota Department of Health. Likewise, any kind of change in treatment, which could make the water more corrosive, we have to pre-approve before it can happen, and then our engineers assist with that. The issues that Des Moines is having around nitrate in their source water, they have 2 rivers that they draw on. Those increasing levels of nitrate, that we used to think that would never happen in Minnesota because our surface water systems like St. Cloud, St. Paul, and Minneapolis, they're on the Mississippi River, but the headwaters was not agriculture, it was hardwood forests, which are a great factory for making clean water. Now that land use is in transition. Those acres are being sold off, and how those are used in the future will change the water quality for those surface water systems. We had the first violation of the nitrate standard for a surface water system last year, and that's not good news for us. Like the spill that they had in Charleston, West Virginia, where there was a coal cleaning chemical stored on the banks of the river, which served as a water supply for Charleston, their capital city. Spills can happen. They've happened in the past in Minnesota. We have a great relationship with the state duty officer and the Pollution Control Agency. But in the East Metro, around 6 suburbs are dealing with perfluorochemicals in their groundwater. And as we learn more about the toxicity of those chemicals, we have to develop stricter standards. And so those communities are having to take action to keep their water safe. And then the last issue is related to eutrophication or harmful algal blooms in surface waters and lakes, in particular in Minnesota. We've had dog deaths. We have more and more of these harmful algal blooms, and that becomes an issue for systems that get their water from a lake. And we have one system in the state where we're monitoring for microcystin, one toxin that's associated with those blooms. And we have to be thinking now about how can we prevent that from being a problem.
Mm-hmm. Well, I'd like to delve into those problems a little bit more deeply, but we want to talk about some of the solutions too in the time that we've got. So we're going to get at that in the next segment. First, we need to take another little break. So we'll be back right after this message. Welcome back. We're talking about Minnesota's water with Anna Henderson from the Minnesota Governor's Office and Tannie Eshenaur from the Minnesota Department of Health. Anna, in this segment, we're going to talk, as in the short period that we've got, about what's being done. And I know the governor has made water one of his top priorities. He wants to leave a legacy of clean water and water action. So how are you framing what you're doing, and what are you doing to move this whole agenda forward?
So the governor has really wanted to elevate conversations around water, and there are many things that are happening in the agencies and many efforts that he is leading the way on. But one of the overarching pieces is to build the water ethic in Minnesota. And that means that every citizen feels a sense of responsibility for how their actions have some kind of impact on the water, and that they are part of knowing and understanding what we need to do to protect this great resource that we all share, and that our actions impact the water for everybody else also. And so there's this consensus that the status quo is not good enough, and it's not okay for our public health, it's not okay for our overall environmental protection. And so to elevate this conversation, the governor has been hosting different public engagement processes. So he's had a number of summits, and these have had over 1,000 people who are involved. So there's lots of interest when he goes out to do this. And going forward, we have a roadmap that shows where we're going to get with our current investments in water, and it shows that by 2034, we'd have a 6 to 10% improvement in water, but we also know that there's going to be some decreases in water quality over that time too, and that is just not good enough. That's not putting us in a place where we are going to be strong economically or from a public health standpoint. And so the governor came out with a 25% improvement goal for water by 2025. And to engage the public on this, He's going out, and his commissioners are going to be doing town halls all over the state. The first one is in Rochester on July 31st. They're going to be in all different parts of the state. They're open to the public. They're free. Anybody can show up. And we're going to find out from people, what does this 25% goal mean for them? What do they want that to look like? What's going to improve their quality of life, their local economy? And then what do they need to achieve that? What are their barriers? Is there support that they're not getting that they need? So this is really about going out at a really grassroots level and hearing from local people about their particular landscapes and their water, what they need and what they want to do, and how we can better help them.
Okay. And Tannie, from the Health Department, what sort of perspective are you taking, and what kind of actions is the department moving forward on?
Well, as we look into the future, we're looking to take action that's going to ensure safe drinking water, safe water for all, everywhere in the state. And primarily, we're looking at doing that through infrastructure improvements, either maintaining existing plants or adding new treatment for some of these chemicals that are new that we're greatly concerned about. We're also continuing our efforts on technical assistance as we implement the Federal Safe Drinking Water Act in the state of Minnesota. We have district engineers and sanitarians who go and do the monitoring in public water supplies across the state. And an area in which we're looking to up our game is in source water protection, because we know by going upstream and keeping contaminants out of the water that we can test for, we're also keeping out contaminants that we have yet to learn about and test for. So it's much more cost effective, and it's much more equitable, because when we protect groundwater for public water supplies, we're also protecting it for some of those private well owners who don't have the same degree of protection from the state. But all of this takes money, and it takes well-educated and prepared staff and scientists. And so we're especially thankful now for money that we have available from the Clean Water Fund. For our systems that get their water from groundwater, from underneath the surface water-bearing rocks, we're required to have source water protection plans where communities come together, identify potential contaminant sources, and take action to prevent those. We don't have the same requirement for the 24 surface water systems. Through the Clean Water Fund, for the first time, we have money to help develop these voluntary plans. And we believe that taking action now to protect will help us ensure it into the future.
Well, it sounds like what you're talking about, this is where the collaboration between the policymakers, the governor's office, and the science in the departments really comes in play. Because I know the governor put things in his bonding bill. You know, we had the policy about the Clean Water Fund, the legacy amendment. We've got the buffer strips, you know, regulations on protecting the water supply. So is the governor working hand in glove with his agencies to say, what are the policies that we need to move this forward?
Yes, and it's a many-leg stool. So there's the bonding money for capital investment to make sure that small cities are able to build the infrastructure they need to treat the water. It's investing in the public health pieces to make sure that we have the information, that we know where these problems are, we know if these chemicals are there. It's the investment in going out and working with people to actually do things on the land, help landowners put in practices that are going to prevent this kind of pollution. So there's it takes many different perspectives and many different stakeholders to address the
Is the governor
issues.
taking into effect climate change? This is we only have about a minute left, but I know climate change is one of these things, and with the big storms that we have because of that, and sometimes drought, is the governor taking that into account in terms of what his planning is about?
Yeah, in Minnesota, we have seen both drought and extreme floods, even in the same years, in the same places, which is a huge, huge challenge to the public. It's a public health and an infrastructure challenge and huge risk. The governor just signed on to a climate alliance. He's also signed on to the Under 2 MOU. These are international agreements with other states and cities saying that climate change is happening, that we need to take action, and that this is vitally important.
Right. Well, I know we're almost out of time, so I want to thank you for being here. We got a lot more that we could talk about. This is a huge issue. Like I said in my opening, water was the core of public health. Public health really evolved from the fact that we didn't have clean water and we had diseases spreading from that. We've got a lot of progress, but it sounds like things are at risk. But we're also having the governor's office, state agencies working collaboratively to make it better. So thanks for being with us.
Thank you.
Thank you.
I'll be back with a closing comment right after this message. Norman Maclean ends his novel, A River Runs Through It, with this paragraph, quote, "Like many fly fishermen in western Montana, where the summer days are almost Arctic in length, I often do not start fishing until the cool of the evening. Then, in the Arctic half-light of the canyon, all existence fades into being with my soul and memories of the sounds of the Big Blackfoot River, and a four-count rhythm and the hope that a fish will rise. Eventually, all things merge into one, and a river runs through it. The river was cut by the world's great flood and runs over rocks from the basement of time. And some of those rocks are timeless raindrops. Under the rocks are the words, and some of the words are theirs. I am haunted by waters," end quote. Maclean had a reverence for water. He certainly recognized it as essential for life. He understood its economic worth, and he certainly valued it for the fish that it contained. But it was more than that. To him, it was sacred, something that nurtured life on a physical and emotional level, and also on a spiritual level, something that he needed to respect and care for. Today, our waters are stressed because we have taken them for granted and treated water simply as a resource to be used. We have viewed water as such an abundant part of nature that it could take whatever abuse we gave it. We didn't realize how fragile water is. We have lost our perspective of water as an integral and ever-changing part of a complex web of life that also has needs of its own if it's going to thrive. We've lost our reverence for water. Water is essential for life, both now and in the future. It is our job to make sure that there is clean water available for future generations. We need to re-embrace that reverence for water. We must be haunted by waters. That's all for today. Thanks for watching. I hope we can join you again next time on A Public Health Journal.